Hello, I'm Tess Kinning, the President and CEO of Bi-State Primary Care Association. Healthcare is at the forefront of our daily news, on TV broadcasts, talk shows, and in newspaper and magazine articles. We hear how access to healthcare brings tremendous value to our nation, and we also hear how the fiscal pressures bring into question the expansion of healthcare coverage. We understand we are living through a difficult economy. We also understand that with scarce public resources, investments must demonstrate a strong return on investment to the taxpayer. As we begin to recapture our former economic prosperity, I want to spend a moment describing the value of sensible public investments that will produce tremendous dividends, not only to our state, but also to our friends and neighbors across New Hampshire. A smart investment is with New Hampshire's 15 community health centers. We provide patient-centered medical homes to over 100,000 granite staters every year. The community health centers are primary care practices that see everyone in their community, including patients on Medicaid, Medicare, commercially insured, and low and moderate income families without insurance coverage. With the rate of health spending growth remaining low for 4 consecutive years, there are proven ways to continue to save sizable public funds by making wise investments in primary and preventive care. In the past, part of the growth in our country's healthcare spending has been due in large part to chronic diseases that have not been managed and could have been prevented. Investments in community-based systems have proven to reduce long-term healthcare costs because not only are many chronic disease costs avoidable, primary and preventive care is a less expensive treatment option. In addition, the community health centers engage patients in self-management and education to improve the quality of their lives. Disease prevention is key to ensuring good health and reducing the financial burden on our healthcare system, as prevention slows disease and injury prevalence. If chronic diseases were reduced by just 25%, we would save over $26 billion per year nationally. In addition, the overall medical expenditures per patient are nearly 25% less at community health centers than the overall medical costs for patients who do not use a community health center. Statewide investments in primary and preventive care also reduce insurance costs and improve our economy. If an employee or a family member of an employee is ill, a business's productivity is reduced due to absenteeism. Opportunity costs need to play a critical role in ensuring scarce resources are used efficiently. The opportunity costs of diabetes, poor oral health, and untreated chronic diseases burden our towns, businesses, schools, and our still fragile economy. A prudent investment in primary and preventive care will produce healthier communities, lower the cost of health care, and also increase worker productivity. You're about to see examples of how 2 community health centers located in rural Cowas County and the more urban Stratford County provide essential team-based integrated medical, behavioral health, and oral health care from committed providers that offer immeasurable benefits to their local communities. You'll see why we at Bi-State Primary Care Association and its 15 community health centers and many other organizations in New Hampshire believe important investments that improve access to primary and preventive care and ensure the recruitment and retention of a strong, committed primary care workforce are among the smartest financial actions our state can make.
My name is Janet Atkins. I'm the Executive Director for Goodwin Community Health, located in Somersworth, New Hampshire. Goodwin Community Health, we provide a completely integrated model. So that means patients that come here can see us for medical care, behavioral health, or oral health. At Goodwin Community Health, we serve about 8,000 unduplicated patients. About 35% of those patients are uninsured, and 70% of those patients are 150% of the federal poverty level or lower. Then we have about 45% of our patients Medicaid, 17% insured, and then the rest are Medicare. So at Goodwin Community Health, we do offer a sliding fee based on the income. We have a team-based approach, and so that means in the team we have a medical provider, a nurse, a couple of medical assistants, a social worker, and a behavioral health specialist. So that's the medical component of it. The dental team is a part of that team if the patient has a problem or is seeing us for dental. About 70% of our patients that see us for dental also see us for medical. Truly, the patient is at the center of the team. We educate them about their plan of care. We try and get buy-in to what they're responsible for, self-management goals, and what the team is responsible for. In some cases, we set up specific times where the nurse will do some education, or the chronic disease manager will set up educational group classes for them. So it really is improving outcomes and improving quality of life for that patient based on what they need, because every patient is individual. We employ 108 people. About 70% of those staff are full-time. We're about a $6.8 million organization, but if we went away, not only would 107 or 108 jobs go away, all of the spending that we do locally throughout Stratford County and through the different cities and towns would go away. So we do have a big economic impact on Stratford County. We are not specialists at Goodwin Community Health. We're primary care. So we do primary care dentistry, primary care behavioral health, and primary care medical health. So if, for example, the dentist run into a difficult problem, a difficult extraction, they will refer to the local oral surgeons. If the medical providers run across a difficult case, they'll refer to a cardiologist or a neurologist. And if it's a behavioral health issue, we do not have a psychiatrist on staff, so we may refer to our local mental health center, which is Community Partners. Goodwin Community Health is sandwiched between Frisbee Memorial Hospital and Wentworth Douglas Hospital. So they're a big part of the healthcare system, and we have programs that outreach into the community. For example, there are a couple programs we're working at with Wentworth Douglas. One is a mental health integration project. Because Goodwin Community Health has been doing integration for almost 5 years now, Wentworth Douglas reached out to us and has used our expertise and our staff to place a licensed clinical social worker in one of their practices. That program has been very successful, and we are going to expand that pilot into other practices at Wentworth Douglas. We have an outreach worker that the hospital pays for, and they're located in the emergency department. When people come into the ER for non-urgent needs, they see this outreach worker, particularly if they have no insurance and no primary care provider. We hook them up with an appointment at Goodwin Community Health. The outreach worker can do that right there when the patient's in the emergency department, but after they're seen. So we've been seeing about 150 new patients from this program a month. We have recently embarked on doing population-based screening for substance abuse. It's an evidence-based practice. It means a few questions for any patient that comes in to the health center that is right now 18 or older for their physical. They're asked questions that identifies whether or not they may have a substance abuse problem. And we're really excited. Again, we're on the forefront of this. We're the first ones to be doing it. And the New Hampshire Charitable Foundation is supporting this effort and wants to see that rolled out for the entire state so that all primary practices are doing this screening. We're looking at what New Hampshire needs, what Stratford County needs, and developing programs with partners around meeting the needs.
As the dental director at Goodwin Community Health, we have integrated our dental program into our fully integrated medical and behavioral health programs. We do a lot of preventative work in dentistry, Prevention includes anything from having a yearly exam. We actually start seeing children at age 1. We like to start early with education so that we can prevent them from forming bad habits that can cause to these missed school days later. With our integrated care here, we actually will see a lot of pregnant patients, and working with prevention for them is an especially important area. When you are going through pregnancy, you have a lot of hormonal changes that will happen, and the hormonal changes can actually cause a lot more inflammation in your gum tissues. Inflammation can lead to eventually bone loss. We've probably heard some of these terms before, but gingivitis can turn into a periodontitis, which is affecting then all the supporting structures of your teeth. We have had a patient recently that has been just an amazing story I'd like to share with you. He is an uninsured male adult that has a young family. They moved to this area recently, and he was jumping between jobs. Part of the fact because he was taking a lot of days off, he kept getting fired because he had dental abscesses that were bringing him in to see us. Additionally, he was unable to find a really good steady job because of his appearance. He was very embarrassed about his appearance. He was missing some teeth already, and he was afraid to smile. And going in for an interview was a very stressful thing for him to do. He did come in to see us, and we went through treatment with him. We took him through his extractions, and we did some restorations. We eventually got him into partial dentures, and I will tell you that has made such a difference in his life. Once he had those partial dentures, he originally started out with a temporary partial. He started going on job interviews again. We eventually got him into a cast metal partial, which is more of a permanent type of a partial. Just seeing his change in life over the last couple of years and get integrated into our community here and purchase a house and start contributing back to society was just an amazing thing to see.
I'm Adele Woods. I'm the Chief Executive Officer of Coos County Family Health Services, which is located in Berlin and Gorham, New Hampshire. Coos County Family Health Services is a patient-centered medical home, and being a patient-centered medical home means that we have additional staff in our offices, our care management team, which frequently contacts patients, especially those who have recently been hospitalized or have used the emergency room. Coos County Family Health Services employs approximately 126 people at our 4 locations. We see approximately 12,000 patients a year, and we have about 48,000 medical visits. The FQHC patient-centered model is engaging in outreach and in-reach to identify our patients who are uninsured and to connect them with resources in the community, the state, and the country that are now available to them. Coos County Family Health Services is the only provider of primary care medical services in the Berlin-Gorham area. As such, we see patients with commercial insurance, patients who have Medicare and Medicaid, and the uninsured. In the next 10 to 20 years, that close to 40% of our population will be 65 and older. This presents a unique challenge to providing their healthcare services, whether it be employing people who specialize in geriatric healthcare or providing transportation as people are unable to get around and to appointments, or any other needs that are associated with growing older. Because of our remote location, it is challenging to recruit primary care providers to our area. We do utilize the services of the Bi-State Recruitment Center, which has been very helpful, and also the state loan repayment, which is more than helpful, in fact, essential to attracting providers to our area. We know that there is a projected shortage of primary care providers. And in order to attract them to areas where they are not likely to want to come without an incentive, it would be wonderful to have even more loan repayment dollars available. Physicians usually come out of training with close to $200,000 in debt. and they are looking almost universally for loan repayment programs. This would be a great incentive for them to come to remote regions such as Coos County. One patient success story we had recently involved an 81-year-old woman who had had a hip replacement. She's very independent. She lives by herself. Her grown children are several states removed. We were able to see that she got 24-hour care until she no longer needed it, and also received assistance with managing her medications, which were complex. We're very proud to say that she did not end up with an unnecessary readmission or any visits to the ER, and now is recovering fully in her home. By working as a federally qualified health center and offering a sliding fee scale, we enhance the ability to get preventive care before something happens that will lead them to use the emergency room or even to a hospital admission. During the past 3 years, our local hospital has seen emergency use decrease from about 12,000 visits to 8,000 visits a year. We feel that a large part of that is due to having a care management team that works with people to educate them about appropriate use of the emergency room and to try and call to get it in with their primary care provider first before going. We also work with them to recognize the signs and symptoms and when it would be appropriate to go to the emergency room versus coming into the primary care clinic.
As you've just seen, appropriate investments in primary and preventive care and loan repayment programs that ensure the recruitment and retention of our clinicians make sense. This investment will lead to long-term savings and economic stability for the patients of the community health centers, the business community, and the state of New Hampshire. For every $10 New Hampshire invests in primary and preventive care, the state saves over $26 million within the first 2 years. By year 5, that number grows to nearly $90 million in savings per year. Bi-State Primary Care Association and the New Hampshire Community Health Centers look forward to a future where all Granite Staters have access to affordable primary and preventive care.